This course is Mark Carey, Dr. Mark Carey's brainchild. I happen to be collaborating with Mark on some basic science translational research, and he asked me to help him find people to speak at this thing. So I did that, and he's asked me to moderate. I have just a few slides here. You know what the subject of today's workshop is. It's genomic medicine. This is an area of research, cancer research, that has exploded over the last 5 to 10 years. The speakers today, Trevor Pugh, Jean-Yves Masson, Mark Carey, and Dr. Schrader are going to give you various perspectives of what genomic medicine has done over the last few years and where it's going to head to. Mark entitled the series is Untangling the Genome, Improving Our Understanding of Genomic Dynamics in Gynae Cancers. My specialty is ovarian cancer. So before I get on to that, Mark has assembled a GOC working group, and these are the individuals who are going to work together. We met today at noon to build more courses like this for the GOC, to bring interested new gyne-oncs and so-called legacy gyne-oncs up to speed in various areas of genomic medicine and other aspects like immunotherapy, for instance, over the next few years. So this is just the first one, and there are going to be many good things to come in the future. Some of these individuals are here today. In fact, I think everybody is here today, except for Susie. I think Susie's not here, right, Mark? She's not? Yeah. So one of the most important things today is feedback from you as the audience in terms of what you think of the information, the quality of the information, and how digestible it is for you. And that will actually determine how we move this course in the future. So the impetus for this type of workshop is illustrated on this slide. I pulled it off a paper called Big Data, and it compared genomics to YouTube, to other types of internet data. And basically what it shows is that our ability to sequence the genome and acquire genomic data is expanding at a ridiculous rate. Right now, this is our current capacity, and if we keep going along this line, by 2025, we're going to be producing 1 trillion billion bases of sequence data every year. Right now, there's about 2,500 high-throughput machines around the world in various countries and various places, working 24 hours a day, putting out sequence data. The key is putting all that data in one place so that everybody can access it and mine it. That's actually happening at the SRA, and so it is incumbent, really, on us as researchers and clinicians to look at that data very carefully, because it will no doubt have a significant impact going forward on how we stratify patients and how we look at disease, very specific diseases in the future. Their genomic imprint, if you will, or their phenotype will be a determinant of how we study them and how we treat these patients. It's already happening, and you all know it, and that's the reason for this workshop. One of the things, so you can see the differences just by way of introduction today, the differences between the different cancers. If we just look up here at copy number variation, this is from a Nature Genetics paper, and we're just looking at endometrial cancer and ovarian cancer, and this is just copy number variations. And you can see just based on the color scheme here that in ovarian cancer, and these are hundreds, these are the chromosomes here. These are hundreds of tumor samples. This is from the TCGA. And you can see immediately, looking across all of these different cancers, of course I can't see them, that there are huge differences in copy number variation. And when you look at ovarian cancer, it stands out as being the most genomically unstable cancer that we've studied thus far through the TCGA, which makes it probably the hardest one to hit because it's constantly changing and it's so highly heterogeneous. And whereas you look at endometrial cancer, it's a completely different story. And targeted mutations there are probably going to be more important in terms of developing specific therapies in the future and personalized medicine. So that's just by way of introduction. One of the things that Mark wanted me to talk about a little bit is trying to build relationships between clinicians and basic scientists like myself in your various cancer centers and how to do that. And what I've listed here is just the way we do it. I'm at the London Regional Cancer Program in London, Ontario. And I'm the director of the Cancer Research Laboratory program there. It's about 16 scientists. And we have translational groups, primarily in ovarian, breast, head and neck, prostate right now. And every one of those groups has embedded clinicians. These are the various ways we make sure that we connect with our clinical colleagues literally on a daily basis. So the scientists are all part of the Z-Site teams that meet on a weekly basis. We have a variety of seminar series. And one of the seminar series that I want to highlight here, and that could become part of a future course through the GOC, is the Eye Care Seminar Series. And that's a seminar series where we have a scientist and a clinician. Each gives 20 minutes. It's oftentimes on a targeted therapy or a new imaging agent. The scientist will talk about the basic biology or the basic biophysics of the targeted therapy, and the clinician will come in and then subsequently give all the clinical trials data on that. And we have a small room, and we only have scientists and clinicians. We don't allow anybody else in the room. And we have about 30, 35 people, and it's open, informal discussion. So I think that could be the model for the future going forward as one aspect of this type of educational program through the GOC.